I'm Dr. Francisco Jimenez, a partner at 8VC, where I lead our life sciences investment practice. I'm here to deliver a warning. China has already disrupted the American biotech industry, and without bold action, we face an existential threat to one of the greatest innovation engines in human history. In a few weeks, we're going to mark the 50th anniversary of the founding of Genentech, the birth of the modern biotech era, and the half-century of American exceptionalism in medicine. The scale of what we've built is staggering. In 2023, the U.S. bioscience industry generated over $3.2 trillion in economic output, roughly 7% of our private sector GDP. It directly employs 2.3 million Americans, and each of those jobs supports nearly 4 more in the broader economy. That's a footprint of 10 million Americans. To understand why the system is so vulnerable, you need to understand how it works. NIH-funded academic research generates insights into disease biology. Biotech startups, fueled by venture capitalists such as myself, translate those insights into potential drugs. Pharma companies acquire or license the winners, selling them under temporary patent monopolies that fund the next generation of R&D. When patents expire, drugs are genericized, arguably the only consistent deflationary force in American healthcare. But this cycle is extraordinarily fragile. The average drug takes 15 years from conception to approval, with a success rate of about 10% and a fully loaded cost of $1 to $3 billion. While we were building this engine, China was watching, learning, and planning. In 2020, essentially 0 medicines licensed by global pharma originated from China. In 2025, that's roughly half. China overtook the United States in clinical trial volume in 2021 and has widened that lead every year since. Cross-border licensing deals from Chinese biotechs exploded from $14 billion in 2021 to $138 billion in 2025, a 10x increase in 4 years. This is not an accident. It was a deliberate state-sponsored strategy executed through the Made in China 2025 initiative started 10 years ago. Heavily subsidized Chinese research organizations provided high-quality, inexpensive labor for our biotechs. Their sea turtle policy sent Chinese scientists to train in U.S. institutions and incentivized them to return home with our knowledge in hand. Copycat Chinese biotechs licensed drugs to global pharmaceutical companies at 50 to 80% lower costs than we were able to do in the United States. We've effectively trained and funded our own competition. And they are competing on an unlevel playing field. While they generate 2 to 5 times faster and 30 to 50% cheaper, this is due in part to running trials in People's Liberation Army hospitals in the Xinjiang region, where credible informed consent is practically non-existent. If this continues, the consequences cascade. Trial sites move abroad, weakening our top research institutions. Our biotech private sector will move away, and beyond economics, we lose control over which diseases are prioritized for the American patients. This means we also lose our biosecurity, our ability to rapidly develop countermeasures to pandemics. Imagine facing the next COVID dependent entirely on what China decides to offer us. On a global scale, the rise of China is fantastic for patient outcomes and biosciences innovation. My perspective is that we cannot seek to compete by blocking Chinese innovation. Instead, we need to take this moment to introspect on the U.S. system and make bold measures to improve ourselves to retain our dominance. We need to set moonshot goals for the U.S. life sciences innovation, to not just follow, but continue leading. Members of the committee, the time for complacency is over. We have to protect this crown jewel, not just for economic security, but for the health and survival of American people. Thank you.